Hi, welcome back to my channel. So tonight I'm doing telling you a little bit more about myself, and one of the things that I have that's going on in my life is I am pre-diabetic. I was a diabetic before, type 2, and I developed that during my pregnancy with my daughter. And for who doesn't know what diabetes is, it's basically a disease that results in you having too much sugar in your blood, or most people say, okay, you have a high blood glucose level. And gestational diabetes is something that you develop during a pregnancy, and most time it goes away after you have the baby, and sometimes it doesn't. For most people, that it goes away maybe in a few years if you do not change your lifestyle and the way you eat, exercise, and consume food, then it will come back. Gestational diabetes causes high blood sugar that can affect your pregnancy and your baby, which in my case, it did. My daughter born and she was like 5 pounds, but thank God she was healthy and strong and had no illness from this. Me on the other hand, I had a few issues because of it that contribute actually to other issues that I have. One of them being what do you call it, preeclampsia, and next was I have an allergic reaction to my epidural where they had stick me in my back. My blood was not clotting fast enough to close back the hole where they stick me, so they had to went back in and basically shoot blood back into my back to close it. Therein lies one of the effects of having it is gestational diabetes. Anyway, like I said, mine is temporarily gone, and I believe that if I keep eating healthy and exercise and try to control my blood pressure, my cholesterol, my diet, this will eventually allow it not to seed back into my life or affect my life. But for the time being, I do take my blood sugar level and take it regularly just to make sure that I'm on the right level. And I'm just gonna give you an example, show you what I do. This is my pouch, and it have a packet right here, and it's like this inside. I have another pouch inside of it, and the first thing you will come upon is glucose tablet. And what this does is in case your sugar level gets too low, and when your sugar level tends to get too low, you will feel you have cold sweat, and you will feel shaky and a little bit dizzy, maybe faintish. So what you do is you just take one of these, and this will bring it back up fast and quick. And this let's see what's it on there. This is a raspberry flavor. It's 4 grams of fast acting carbohydrates per pill, fat free, gluten free, sodium free, and caffeine free. And this will help to bring the sugar back up. In my case, it is like this. And what I have in there is extra battery. That's from my machine. I have my machine is a True Track. I have a log that I keep all my numbers written down. Band-Aid, just in case I need it. Neosporin for when I inject myself. rub it on it, and it helps to eat it because it tends to make your finger very tender. I have extra lances, Vegas, that I use to prick myself. Don't want those to fall out. So. Then I have my machine, like I said, which is a 2-track, and it has 3 buttons on top, and this is a code for the strip that you put in. It's coded, and you just install the strip right there. Then I have my lancer, which is like this. It has a needle in it already. The needle is installed right there. Connect it back. It's a clip, button to flight. So once you're going to use this, you turn it to whatever depths you want it, and usually, as you can see, there's a number on it. So usually I turn mine to 5 because I like to be able to, when I juke myself, it goes through one time, so I don't have to keep juking myself just to get some blood to come out. Most time I think the 5 they recommend that you stick in your arm if you're going to use the 5, but most time I do my finger. So you turn it to the desired you want, and then when you do pull it out and fight it. That's it. And the next thing is test strips, and test strips are like this, like this. So for you tonight, I'm going to go ahead and demonstration for you to show what I do. So once here, I'm going to go ahead, and that will bring the machine on. You're going to go ahead and you install the strip. So the strip, it comes up like this, and it shows you that you need to put some blood on it. So I'm going to go ahead. Actually, I don't know how long I have this needle in there, so I'm going to go ahead and change it. It's best for you to do that. If you're uncertain at any point, it's best to just go ahead and change it to just be on the safe side, that you're not using a contaminated needle. So I'm just going to go ahead. I'm going to change the needle, and the other one, possibly use one, I'm going to put into this. This you cover it, and then you can throw it in the garbage. That means you're guaranteed that it won't stick anyone else. So I'm going to go ahead, put this in, turn it to my desire, put it in, turn it to my desire number, put like this, and then I'm going to stick myself. Ooh. And there you go. And after you've done that, then you go ahead and try to get as much blood as you can, and just the tip, and then it's going to give you a countdown, and it gives you a reading. And right now it's saying mine is 185, which is very, very high. It's extremely high. So at this point, I will just go ahead, or I will about to go ahead and just take one of my pills to bring down the level. And the reason why it's high right now is because I just eat and had a cup of tea, and yeah, that's basically why it's high. So yeah, so that's it. After I have done that, then I will go, excuse me, go ahead and I get the Neosporin. That was way too much right there. And I just applied Neosporin to it. It's basically, you won't see the mark. Yes, so that's basically what it is. So if you have any question or you have any comment you'd like to leave below, any question you want to ask, please leave it and I will answer your question as fast as humanly possible. Thank you so much for watching, and remember, on the combat no year. Thank you very much. Good night.